Good morning, everybody. Thank you so much, not only for the opportunity to do this project, but for the opportunity to talk about it here. My name is Annie Rowan. I'm in the program in public health. My PI is Tim Allen Bruckner, who's also a grantee on another project of his. I also wanted to acknowledge my two collaborators at LA County USC, Doctors Andrew Young and Helen Yang. So I couldn't formally list them as co-Is in the grant. They're not UCI affiliated, but I did just want to acknowledge their contributions to the project. So the goal of this project is to understand Latino undocumented immigrants' healthcare utilization patterns during the COVID-19 pandemic, by examining ER visits to the largest safety net hospital in Los Angeles County. So we know that Latinos have been disproportionately infected with COVID-19. This is true both in the state of California as well as in Los Angeles County. But we know virtually nothing about how undocumented immigrants are faring during the pandemic. It's very likely that they have similar infection patterns and risk as the general Latino population. And I can talk about that more in the Q&A, but so they likely have elevated risk, as does the rest of the Latino population, but we know that they are less likely to access care. And this is because they are not covered by insurance to the same levels as the general population, and they also have a lot of fears of immigration. So I have two aims for the project. The first is to look at the time period between February and June of this year, to look at all ER visits and to examine whether undocumented immigrants are more or less likely to have a COVID-related ER visit during this time period compared to other patient groups. And the second aim is to determine whether undocumented Latino immigrants had anomalous ER utilization patterns during the COVID pandemic compared to previous years. So the setting is the LA County USC Medical Center. This, again, is the largest safety net hospital in Los Angeles County. Around 30% of hospital admissions are from undocumented patients. The hospital sees 150,000 ER visits every year. So this is a very highly trafficked hospital, and also one that sees a very substantial population of undocumented patients. Another reason why I think this is an especially good setting to answer this question is because immigration status is typically extremely difficult to study or to get that kind of information. But we feel pretty confident that we can identify the undocumented patient population with a good degree of validity using health insurance. And again, I can talk about the details more during the Q&A, but I definitely think that's a strength of this data that we have. So the way that we'll be answering these questions will be using sort of a lot of biostatistics and econometric approaches. So in aim one, where we're just comparing the undocumented immigrants to other patient populations, we'll be using multivariate regressions to determine whether or not these undocumented immigrants are more likely than other patients to visit the ER for COVID-like symptoms. And in aim two, we'll be using a method called an interrupted time series analysis to compare ER visits of undocumented immigrants between February and June of this year to previous years. So I just drew a little schematic that illustrates the logic of the analysis in aim two. So on the x-axis, we have time. On the y-axis, we have ER visits for flu-like symptoms. The blue line represents patients who are documented. The red line represents patients who are undocumented, and that vertical line in the center is the COVID pandemic. So before the pandemic hits, we see this sort of seasonal pattern of ER visits for both documented and undocumented immigrants. But after the COVID pandemic, we see an increase in the number of ER visits for flu-like symptoms for documented immigrants, but we don't see that same level of increase for undocumented immigrants. At least this is what our hypothesized pattern is. But we also know that ER utilization for other health conditions went down generally. So for both aims, we will be considering other health outcomes such as mental health and injury to see if our findings are specific to COVID or if they represent sort of general ER utilization during the pandemic period. So when I think about why this project is significant to COVID public health efforts, we know, and I think it's expected, that Latinos and Latino undocumented immigrants in particular are going to be really central and important to future mitigation efforts. But this population is extremely hard to study and extremely hard to reach. And so I think any information that we have on them will inform the kinds of mitigation efforts that can be successful. So for example, if we find that undocumented Latinos are reluctant to engage with the medical establishment, we find that they didn't utilize the ER to the same degree as other patients did, I think then we have to really consider a wider range of containment efforts that engage with community-based, faith-based, or other non-medical organizations. Finally, I see this project serving as pilot data for actually an RON that I'm already planning. This RON is generally about whether preventive care improves chronic conditions among undocumented immigrants. But I've decided to add a third aim to look at whether preventive care improves COVID-related outcomes among undocumented immigrants, primarily through diabetes management. So thank you very much again for the opportunity to share. And do I take questions now, or are we taking them all at the end?
Take questions now would be great. Yeah, so we have 5 minutes, for a little more than 5 minutes for questions. Thanks very much.
It's me, Suzanne, Mike Bookmeyer. You should know that the California Institute for Regenerative Medicine is also very interested in this same issue. We just received instructions this morning on how to review grants that are coming in, looking for funding to study the undocumented population, to study Hispanic and Black populations as well. So it is an issue that's on the front bumper if anybody is interested in pursuing that to a different level.
Okay, oh, that's great to know. And this is, you said it was the California Institute for Regenerative Medicine. Is that based at the School of Medicine? Or?
No, so this is the statewide committee that's been funded by the bond issue in 2003.
Okay.
So this is the group that's in charge of renewing the bond that's coming up, we hopefully in the November ballot for the $5 billion call. And actually there's a representative on there who's very active in Latino groups, and I'd be happy to put you in touch with her.
Great, thank you.
On the Independent Citizens Advisory Oversight Committee for that.
Oz Stewart is on their advisory board as well.
Right, so so that's really a good suggestion. Thank you, Mike. You're reviewing proposals for them, is that right?
I've been doing specialist reviews on COVID.
Do you know how many proposals they've funded?
I'll share that with us.
Yeah, okay.
It's about 4. As I said, I think they funded 1 clinical trial, and they've got 3 new grants that I saw.
So Annie, how many, maybe you said this at the beginning, how many different sites are you monitoring?
So it's one, it's the one hospital, the LA County USC hospital.
Okay. And that's because you had contacts there?
Yes, yeah, so my 2 collaborators are internists at, or they're hospitalists at LA County.
Because I know Dan Chow and Peter Chang are also tracking them at UCI MC. So I don't know if there is additional information that would be helpful to you coming out of their studies.
Oh, okay, yeah.
Looking at the changing demographics of COVID patients in the UCI MC catchment area.
Oh, okay. I can look that up and look up their contact information. Thank you.
Yeah, so we can follow up later today.
That sounds great.
Yeah. Any more questions for Annie?
Dr. Rowe, have you looked at, are you able to pull social security numbers when you're looking at your patient population? We've done that in the past.
No. So, I'm sorry, go ahead.
Just because sometimes when you're just using insurance status, you also capture a lot of the just generic uninsured population. But usually in the ED, if they don't have an SSN, we just key in all 9s or all 0s or 1, 2, 3, 4, 5, 6, 7, 8, 9. and that can be an additional identifier.
Yeah, that's, so I don't have social security information, but one thing I had mentioned very briefly in the presentation is that, so LA County has something called My Health LA, which is a county health plan that's basically for people who don't qualify for Medicaid, low income folks who don't qualify for Medicaid, and 99% of those are undocumented. So we feel pretty confident that if we use this payment code for this specific county-based health plan, that we're going to be identifying the undocumented patient population with a good deal of validity. We won't necessarily get those who aren't on My Health LA, but this hospital is sort of the way the plan works. This hospital is sort of the place where they go to the ER, any specialty care. So we'll be getting a good chunk of those patients.
And are you collecting any disposition data after their ED visit, or is it just whether or not they show?
Yeah, so far, I mean, the medical records, as you can imagine, I don't have a whole lot of information. I haven't done, so when you mean disposition, do you mean like more
Whether
just,
or not they're admitted? Because one of the things that we found
yeah,
often with the undocumented population is that they access the healthcare system through emergency rooms at a much higher rate, but they also tend to wait much longer before they access the system, so they come in much sicker. So they have a higher admission proportion.
yeah, so we can actually link their admissions data also. So the initial project that before this COVID project started was actually just looking at their inpatient visits and the inpatient related outcomes, but now we're expanding it to the ER. So yeah, we can definitely look at some of their inpatient records also. That's a good suggestion.
Okay, thank you very much.